people.
Let's bring in one of the architects of Obamacare, Fox News contributor, author of Prescription for the Future, Dr. Ezekiel Emanuel. Zeke, good to see you. Thanks so much for joining us.
Good to be with you, Maria.
Your reaction to what took place last night?
Well, now we can get down to the business of actually doing what the country wants. As Senator McCain himself said in his statement, you know, what the American people have said loud and clear for the last few years is the problem is affordability and quality of care, and that's where they would like the attention. Ironically, I think there's a lot of bipartisan agreement on what you need to do to get more affordable health care in this country, and that's where we should be focusing the attention.
Yeah, but also choice, right? Because all these insurance companies keep pulling out, people don't have a choice.
Well, on that score, Maria, I do think that there are some simple things that can be done that can both bring down the premiums in the exchanges and give people more choice by having more insurance companies come in. They need, what do insurance companies need? They need predictability. And to get predictability, we need first to guarantee them the cost-sharing subsidies, that they're going to be there. We need to give them the reinsurance and the risk corridors so that if they get a disproportionate number of sick people, that they're not penalized. Those two things would actually bring more insurance companies back in and bring their premiums down. So I think those are probably, from the exchange standpoint, places to start.
Wait, but Dr. Emanuel, you're talking about the predictability, and the problem is you don't need to get health insurance until you're sick. You're not incentivized to do that, so it's just sick people keep going into these pools and into these programs. That's why the insurers are leaving the marketplace.
Let me remind you, first of all, that actually is factually incorrect.
How?
Let me
How
remind
is it factually
you
incorrect?
What's wrong with that?
I'm about to tell you.
Okay.
The individual mandate and the employer mandates remain the law of the land. The government, the Republicans, Secretary Price, needs to enforce those rules. That gets more people in. The reinsurance, removing the reinsurance, which Senator Marco Rubio and the Republicans did, is probably the single biggest thing to drive the premiums up and to get the insurance companies to be hesitant about going into marketplaces.
Well, how do you explain that? How do you explain the prices going up even before the Republicans did anything? I mean, we know how the year started. Arizona was up 116% in terms of premiums. That was before the Republicans did anything.
Maria, I don't want to get into a yelling match with you.
Absolutely not. No, I don't want to either.
Right. The risk corridors that Marco Rubio removed were removed in 2015, and that's what affected the premiums in 2016 and 2017. Actually, if you look at the profits of the insurance companies before all this upset about the Republican, whether they're going to repeal or not, get rid of the mandate or not, they actually have stabilized. They're actually making money in the exchanges. So I think we had a one-time correction over 2 years. But if we could do the cost-sharing subsidies, the risk corridors, enforce the mandate, more targeted advertising, I think the problem of competition and the problem of access in the exchanges would be solved. But the long-term problem of affordability is a problem of getting hospitals and doctors to change how they treat patients, not to wait for them to get sick, but to proactively go out and keep them healthy. That is a different problem. It's the affordability problem, and that's what the American public really wants addressed now.
But Zeke, it's Dagan McDowell, because you and so many doctors come on and talk about this ad infinitum, and that is an impossible problem to tackle, is it not?
No. So I've actually prepared, the president has seen, a memo with about 9 or 10 things that could be done that could directly address this problem of cost control. Let me just give you one of them.
Well, how come it hasn't been done yet then?
You asking me? The president has had that memo for 3 months now.
All right, well, give us the one thing that you're talking about impacting the cost control.
There's not one thing. As I said, there are a list of 9 or 10 things.
The example
but one of the things, one of the most important things is changing how we pay doctors in hospitals. Right now, we pay them fee for service. Every time they do something, they remove a prostate for suspicion of prostate cancer. They do a procedure on the knee, they get paid. Instead of that, we have done, and Medicare's actually pioneered this, a lot more change in payment. bundle payments, putting all the fees of a surgery together, the operating room, the surgeon's fee, the anesthesiologist's fee, the recovery time, the rehabilitation, put it in one fee, give it to the doctors and hospitals and say, you guys figure out how to make this more efficient. That actually works remarkably well. Or capitation, saying we're going to pay this amount for people, adjusted for their risk and how sick they might be. And again, doctors and hospitals can figure out how to deliver care more efficiently, get rid of unnecessary care, reach out to patients who are sick. So changing how you pay. Right now, the federal government has committed itself to 50% of its payment in these so-called alternative payment models by 2018. If they made private insurance companies do it, private insurance companies who get contracts with the government through the exchanges, through TRICARE, through the federal employee health benefits, that they have to do it, you would have a big push in the right direction. That's probably my #1 suggestion, and it would make a huge difference.
Do you think that the Democrats are going to reach across the aisle and that these two groups are going to be working together to fix Obamacare? What do you think?
Maria, why does the Democrats have to take the initiative? I think the Democrats are open. It really is the Republicans who rule the House, the Senate, and the White House. They need to take the initiative. But I don't want to get into a second-grade thing. Who starts it?
Right.
The fact is we need to come together. There needs to be a bipartisan approach to this. And again, I've suggested that we, if you put policymakers from both sides in, you put some politicians from both sides in, you could come up with 60–70% agreement on good policies, and again, focused on shoring up the exchanges and cost control and affordability.
All right, we'll see if they're going to use your ideas.
Would make the country go forward.
Yeah, we'll see if they use your ideas. Zeke, good to see you, sir. Thanks so much.